for opening charts and finding patients in the inpatient setting. Your homepage opens to the ambulatory organizer, which is most commonly used for outpatient, but it might be useful for surgery patients specifically, because they will show up on the surgeon's schedule. So here we have a patient who is scheduled in the OR, and they will show up on the primary surgeon's schedule. If you are the assistant or the resident, you may need to make sure that you add that surgeon's schedule to your options for your ambulatory organizer in order to find them that way. When you open the chart from here, then you will get that surgery visit, and you can make sure that you're on the correct encounter. From here, if that patient is going to be admitted, you can add that patient to a patient list, either a department list or a personal rounding list. So I'm going to go ahead and do that with this patient. I'm going to add them to a patient list and to my rounding list. And so that would be another way to open the patient's chart through the rest of their hospital stay, either from opening it from the patient list, where you can click to open and get the correct encounter there, or from the physician handoff work list, where you can also get other clinical information and do your handoff from there. And you can display any patient list in the physician handoff. So you can open the chart from there. Other places where you can see surgery patients is you can look at the actual surgery schedule. And so you would make sure that you are looking at the correct location. So if you're looking in the North Tower Main OR, make sure you've selected that. And then you generally can search by date, but you can search by date, patient, provider, or chart number. And then once you find that patient on your schedule, you can go ahead and open their chart from there. One last way of finding patients in the inpatient setting is to use tracking shells, and the tracking shells are available for the ED departments and the labor and delivery departments. And these are a board where all the patients are visible. So if the ER calls you and asks you to see the patient in bed 5, you can go to the tracking shell and then open the chart of the patient in bed 5, and it will take you to that correct encounter for that visit on that day. The last way to look at it to find a patient for inpatient would be to use the search box. The problem with using the search box is that it's very easy to end up with the wrong patient encounter, and then things like orders will not go to the nurse or to the pharmacy, and it can create serious problems. So you should preferentially use any of those methods before trying to use the search box. And if you do use the search box, you have to be very careful to select the appropriate visit for the appropriate encounter for that visit. So this was a video on finding patients.